Hello, and thank you for joining me. My name is Professor Menzies-Gow, and I am a practicing pulmonologist at the Royal Brompton Hospital, located in London. Today, I want to introduce you to the mechanism of action for TEZSPIRE, tezepelumab-ekko. TEZSPIRE is an add-on maintenance treatment for adult and paediatric patients aged 12 years and older with severe asthma. TEZSPIRE is not indicated for relief of acute bronchospasm or status asthmaticus. TEZSPIRE is the first and only human monoclonal antibody that binds and blocks thymic stromal lymphopoietin, also referred to as TSLP, and helps prevent its interaction with the heterodimer TSLP receptor. The mechanism of action in asthma has not been definitively established. TSLP is an alarmin released by the airway epithelium in response to environmental triggers, including viruses, allergens, pollutants, bacteria, and other stimuli. Once released, TSLP can drive allergic and eosinophilic inflammation, as well as T2-independent effects. Over the next few minutes, I will share additional information about the TEZSPIRE mechanism of action. Please note that some of the results are descriptive only, and their clinical significance and impact on asthma have not been definitively established. By blocking TSLP at the top of the inflammatory cascade, TEZSPIRE helps reduce biomarkers associated with airway inflammation. In the 52-week Navigator study, the impact of TEZSPIRE on blood and exhaled biomarkers of inflammation was evaluated in an all-comer population of patients with severe asthma. Patients were enrolled in Navigator regardless of their biomarker status at baseline. A reduction in blood eosinophils and exhaled nitric oxide was observed at week 2, the first time point measured, and that reduction was sustained throughout the 52-week study. In addition, TEZSPIRE resulted in a slow but progressive reduction in serum total IgE concentration throughout the 52 weeks of treatment. Please note that these results are descriptive only. TEZSPIRE has also been shown to impact tissue eosinophils and airway hyperresponsiveness. In the Cascade study, approximately 100 patients with severe asthma underwent bronchoscopy and biopsy after receiving either TEZSPIRE or placebo for up to 52 weeks. Treatment with TEZSPIRE resulted in an 89% reduction in airway submucosal eosinophils versus a 25% reduction in placebo-treated patients. The assessment of AHR was an exploratory outcome in the Cascade study. The figure shows the change in cumulative dose of inhaled mannitol required to result in a 15% reduction in FEV1, otherwise known as the PD15. AHR, as measured by response to mannitol, was reduced in patients treated with TEZSPIRE versus placebo, with the end of treatment mean change from baseline of 197.4 milligrams with TEZSPIRE versus 58.6 milligrams with placebo, indicating a reduction in AHR with TEZSPIRE. By blocking TSLP at the top of the inflammatory cascade, TEZSPIRE was shown to impact two hallmarks of asthma: airway inflammation and airway hyperresponsiveness. We will now review important safety information for TEZSPIRE. TEZSPIRE is contraindicated in patients with a known hypersensitivity to tezepelumab-ekko or its excipients. Reactions, for example rash or allergic conjunctivitis, can occur after administration of TEZSPIRE. These generally occur within hours of administration, but can have a delayed onset. Consider the benefits and risks. Do not abruptly discontinue corticosteroids. Dose reductions, if appropriate, should be gradual and may be associated with withdrawal symptoms and/or unmask previously controlled conditions. Treat patients with pre-existing helminth infections before starting TEZSPIRE. If patients become infected while receiving TEZSPIRE and do not respond to anti-helminth treatment, discontinue TEZSPIRE until infection resolves. Avoid use of live attenuated vaccines. Most common adverse reactions include pharyngitis, arthralgia, and back pain. Thank you for joining me as we reviewed the mechanism of action for TEZSPIRE, the first and only biologic approved for severe asthma without phenotypic or biomarker limitations. I invite everyone to review the full prescribing information, including patient information, at tezspirehcp.com.